Welcome everyone on what's been a beautiful and really unseasonably warm day here in the Philadelphia area. I hope it's been nice where you are too. This is a virtual information session about the Master of Healthcare Innovation degree at the University of Pennsylvania. It's the first fully online degree program at Penn. And before we get started, I want to go over a few housekeeping items. Your video and audio are muted, and they'll stay muted throughout the presentation. There will be a dedicated Q&A session at the end of the presentation. If you have questions as we're going along, you don't have to wait for the Q&A at the end. You can feel free to type your question in the chat box. But again, your video and audio will stay muted until we get to that Q&A session at the end, at which time if you'd like to ask a question out loud, you can unmute yourself then. I've also put up my email in the chat if you'd like to contact me with any questions after the session or outside of the session. And we are recording this session, and the recording will be emailed to everyone afterwards. My name is Catherine Rodella. I'm the program manager of the Master of Healthcare Innovation, which means I work on the administrative side of the program. A good chunk of my job involves student support, and I'm the first point of contact for applicants and students. Also on the call, who will be joining a little bit later, is my teammate Adam Zolkover. Adam, would you mind introducing yourself quickly?
Hi, I'm Adam. I'm the Associate Director for Online Instructional Design, and what that means is that I work with faculty to help translate their expertise into purpose-made online courses.
Great. Thanks, Adam. And you guys might be hearing an ice cream truck in the background of my audio. That just tells you how warm it's been here today. Again, there will be dedicated time for Q&A at the end of the presentation, but if you have questions along the way, go ahead and type them in the chat box. The Master of Healthcare Innovation degree, or the MHCI, is a master's degree conferred by the University of Pennsylvania. It was designed from its beginning to be online using the best and most effective online learning practices. So this was not a program that existed in person and has been translated into an online degree. It's always been online and was designed that way. The degree is housed in the Department of Medical Ethics and Health Policy at the Perelman School of Medicine at Penn. The MHCI is designed to help you improve healthcare delivery and to adapt to the rapidly changing healthcare landscape. And these are skills that are really essential for healthcare professionals, maybe now more than ever. The degree is meant to help you answer questions like, how can you shape policy? How do you influence patient and provider behavior? How do you identify inefficiency or test solutions through rapid iteration? And these kinds of topics are really, really important, but they're not necessarily covered in medical school or nursing or business school. So this is part of what sets the MHCI apart as a unique degree. So what will the program actually help students do? First and foremost, you'll build a network. Your fellow students will become a resource network for you. Our students are professionals from a huge variety of different healthcare backgrounds and different healthcare sectors, and they really do learn a lot from each other. You'll develop specialized skills for designing solutions to systemic problems in healthcare. This is not a research degree, it's a practitioner's degree. You're going to practice skills and tools that you can apply in your work immediately, and skills that also will inform the way you approach future roles, in healthcare. And finally, you'll not only learn about fundamental healthcare innovation concepts in courses, but you'll also get a chance to actually apply these new skills and concepts in lab courses, so that by the end of the degree, you'll be fully equipped to implement an innovation project in the real world. What sorts of skills will you be learning in these courses? You'll work on skills in primarily innovation and leadership. This particular focus and kind of unique combination is part of what distinguishes an MHCI from, say, an MBA or an MHA, which would have a different focus. Innovation skills might include things like idea generation or complex problem solving. And leadership skills are things like communicating and pitching your ideas, networking, and persuasion. The MHCI, much like the innovation field itself, is a very interdisciplinary degree. Many of our faculty, of course, come from the School of Medicine and the Department of Medical Ethics and Health Policy where the program resides, but there are also faculty members in the program from Wharton, Penn Law, the Penn Medicine Center for Healthcare Innovation, and Penn Nursing and Penn Design. These faculty are all world-renowned experts in the degree's 4 primary areas of focus, which are health policy, behavioral economics, operations management, and innovation methodologies. So these faculty members, like for example, Zeke Emanuel, who teaches the American healthcare system, and Kevin Volpe, who teaches our behavioral economics courses, they're active decision makers and researchers in their fields at the national and international level. So you get access to their expertise through the course material, and you'll also have the opportunity to interact with faculty in weekly live sessions. Now this slide shows the curriculum in a little bit more detail. You can see listed here all of the course titles that students take throughout the degree. This specifically shows the layout of the curriculum on the 20-month track. There is also an option for a 3-year track for students who might want to spread out the workload over more time or spread out the financial commitment over a longer period of time. But no matter which track you choose, the 20-month or the 3-year, it's all the same exact courses and same exact degree requirements. Each school year kicks off with a 4-day seminar, which you can see in the upper left highlighted in green. Seminar is a virtual event with orientation activities and educational and social activities to get you ready for the school year. And I'll talk about that in more detail in a minute. Students take intensive online courses one at a time. The core courses that you can see in blue are 6 weeks long. Typically, there's a 1-week break in between courses. So again, 1 course at a time for 6 weeks, and then typically a 1-week break in between. In each of these courses, students are spending about 13 to 15 hours per week on schoolwork total. The students will also take 4 lab courses. Those are the courses in yellow, that you see here. Labs are a little bit different because in labs, students complete projects and assignments to practice applying concepts that they've learned in the core courses. Finally, students have the opportunity to take 2 electives in which they can choose from a selection of topics that meet their own interests or goals. And then you'll see under that spring 2023 semester, in their final semester, students meet with their cohort in person for an event called Innovation Weekend. And I'll explain that in detail in a couple of slides. But first, do we have any questions so far about the curriculum? Yep, please put your questions in the chat as we go. And again, there will be dedicated Q&A at the end of the session. So during that dedicated time, you'll be welcome to unmute yourselves. But for now, we'd like you to stay muted and please put questions in the chat. I see one question: what time of the day do the courses take place? So courses are a mix of asynchronous and synchronous activities. For the most part, they're asynchronous. So there are, deadlines for assignments, but you can access the content at any time. The asynchronous piece is a once-a-week live sync class. It's a video conferencing session for 1 hour a week on BlueJeans. The time varies by course, but very often common times that we see for those are around noon Eastern time or 4 or 5 o'clock Eastern time. So you can expect they might happen during the workday on East Coast time. I have another question about how much time on average students spend a week on coursework. If I could reiterate that, sure. It's 13 to 15 hours per week while a course is running. So again, students are taking 1 course at a time, usually for 6 weeks. The 4 lab courses help students gain a deeper understanding of concepts that they've learned in core courses by putting these concepts to practice. So For example, in the behavioral economics lab applying behavioral economics, students will get a case study to analyze and they'll write a proposal for a behavioral economics intervention. So the labs really are project and assignment based, very independent work, though students are often asked to provide feedback on other students' work. The first two labs are very focused on teaching students how to get their ideas out into the world. And then the final two labs ask students to draw on their own work experience to develop an idea for an innovation project and get ready to put that project into practice. So this way, at the end of the degree, you actually have a solid written project proposal in hand that you're ready to implement in the real world. Again, students have the opportunity to choose two electives according to their own interests and goals. Much like core courses, electives are taken in 6-week blocks. You see this list. This is an example of the elective topics that have been offered this year, and elective offering subjects might change from year to year. I'm going to pause for a moment to see if there are any questions. Can any of the courses be waived? The curriculum is great, but I see a few similar to a previous degree I completed. It depends on how much overlap there is between other courses that you've taken. We can take a look at that on a case-by-case basis, and our assistant faculty director will decide if there's enough overlap to let a course be waived. Most often, if a course is substituted in, it might take the place of one of the electives. But again, that's something we can take a look at on an individual basis.
Hi, Catherine. Nadav.
Sure.
I'm sorry. Nadav has a good question here, which is, are the live or synchronous classes recorded so that they can be viewed on our schedule?
Yes, great question. All of the live classes are recorded. So you're expected to either attend live if possible, or if you can't, you can watch the recording afterwards. The students will attend two different types of events throughout the degree, both of which I had mentioned in that bigger curriculum slide. The first one is something called seminar, which is a virtual event. Students are required to attend seminar every year in late August to kick off the school year before courses begin. Seminar is a great chance for students to get to know each other and the faculty and to really start building and strengthening these connections that they've made. Also at seminar, you'll do different orientation activities, and new students especially will learn how to use the online learning tools before they ever start taking classes. So you'll be a natural at using all of that online tech before you have to worry about it in classes. There also will be engaging panels with healthcare innovation experts. And we really think of seminar kind of like a virtual summer camp. It's really fun, and as students get to know each other and build bonds quickly over that relatively short amount of time. An Innovation Weekend is an in-person event that students can attend in their final year of the program, so during the year in which they'll graduate. It's a 2-day event on Penn's campus in Philadelphia, and the goal of this weekend is to begin preparing students for life after the MHCI. The focus is a lot on networking and idea sharing and feedback. Students also will have an opportunity to meet our alumni who are invited back each year for the second day of Innovation Weekend. Of course, I just have to say that plans for any in-person events at this point are subject to change depending on what the public health measures are at the time. Any questions about these student events, seminar, or Innovation Weekend?
Jenica has a question. Is seminar always virtual, or can this change because of COVID?
A great question. In the past, we have had in-person seminars. This past year, it was virtual, and we found that having seminar as a virtual event was really effective and really valuable for students, in part because they became experts really at using all the online tools and connecting online before courses started. So we found that students this year had a much smoother transition into taking classes and really could just focus on the content instead of worrying about learning about the online technology. It also gave us the opportunity to get analysts from all different places that might not have been able to come together in person at the same time. So it It makes sense to have seminar, the first event of the program, be virtual for a number of reasons. But again, that innovation weekend is there so that every cohort will have an opportunity to come together in person at some point during the degree.
Ridar asks, is the degree primarily targeted at students in the U.S., or are international students welcome to enroll too?
International students can definitely apply. We have several international students, one of whom actually you'll hear from a little bit later in the call. There are no additional requirements for international students when you apply, except that your transcripts just need to be translated into English. I see a question. Are there mandatory years of previous experience upon application? Yes, you need to have at least 3 years of professional experience, either in healthcare or in a related field. Let's take a look at one more question before we move on for now. If you choose the 3-year curriculum, how many hours a week should we expect to spend on coursework? That remains the same, so while you're in a course, it's still going to be 13 to 15 hours per week. The difference is that on the 3-year track, you often will have more time off in between courses, but you'll still be taking those 6-week intensive courses. So who are MHCI students? They are mid-career healthcare professionals. They come from many different backgrounds, but they all have a shared goal of improving the way that healthcare is delivered. Currently, there are 82 students across 2 cohorts in the program. The newest cohort that just started this current fall welcomes 47 new students into the program. They have an average of 13 years of professional experience, but there's a big range there. We have some students who are earlier in their career who have maybe 3 years of experience, and we have students who have over 30 years of experience in their field. And they come from all over the US as well as abroad. And you can see we've listed here some examples of different roles and healthcare sectors that students have come from. Again, the student body is very professionally diverse, which enriches course discussions and allows students to learn a lot from each other. Just keep in mind, this is not an exhaustive list of every type of healthcare professional that could be a fit for the degree or who could benefit from the degree. There are certainly many, many others who have not been represented yet as well. And if your professional experience is outside healthcare, but maybe related to healthcare, you're still welcome to apply. I would just recommend that you really clearly demonstrate in your personal statement on the application how that non-healthcare experience could translate into an impactful career in healthcare. And even though our students are very, very different and diverse, like I said, there are a few different reasons why they do the program. First and foremost, they're all passionate people who want to improve healthcare delivery. Some students choose to do the program because they want to improve the work that they do in their current role. Some students are taking on a new role or maybe have just started a more leadership role and they want to learn skills to be able to be successful in it. And finally, some students aspire to a more leadership role in the future, and they think that the skills in the MHCI are the skill sets that their employers will be looking for. I'm very excited to welcome 2 MHCI community members today to talk about their experience in the program. So I'm going to stop sharing my screen for a moment. Nadia is a current student in the MHCI. She's a registered nurse at Cleveland Clinic, Abu Dhabi, and she's finishing up her final year in the MHCI. Will be graduating this spring. Tom is the Chief Financial and Administrative Officer at Learn Behavioral, as well as a recent alumnus who just graduated this past May. So welcome. Thank you both for being here. And first,
Hi, everyone.
Hi, Nadia. I'd like to ask you guys to briefly introduce yourselves. So, Nadia, would you mind starting?
Sure. Thank you guys for joining and thank you for having me. So my name is Nadia. I'm currently working in the United Arab Emirates. I've been here on and off for the past 12 years. Prior to moving over here, I worked as a registered nurse as well in North Carolina. And I've been over here for the past few years, and I'm in cohort 3 and looking forward to finishing up this May, hopefully. And that's basically it, registered nurse.
Thank you. All right, Tom, could you introduce yourself?
Yeah, sure. Hi, my name's Tom Simpson. I live in Philadelphia, and I've been in healthcare for approximately 20 years on the administrative side the whole way. My background and passion in healthcare is home and community-based care. So I've spent my entire healthcare career in home healthcare and behavioral support therapy, specifically care for children on the autism spectrum disorder for the last year and a half or so.
Great, thanks. So my first question I'd like to ask Nadia as a current student in the program, it's a question that I get a lot from prospective students, which is how do you balance, the work in this rigorous degree with your professional responsibilities and other responsibilities in your personal life?
Yeah, so I actually find that this degree is perfect for someone in my situation who is approximately, I'm 9 hours ahead in the time difference. Between the recorded lectures and the flexibility in assignments, as well as kind of my own schedule. Being a nurse, I have kind of a very flip-flop schedule. I'm able to manage not only working between 40 or 36 to 60 hours a week, but also able to manage completing all of the assignments on time. And then, of course, with that comes personal life. And I find that actually there's quite a good balance. And something that really, really helps is the recorded sessions, the recorded live sessions, and the ability to really like look back and discuss things with people via our discussion posts.
Thank you. Tom, anything you'd like to add about how you balance it all?
Yeah, I think for me it was sort of a function of don't get behind, really try to stay disciplined. Um, during the time in the program, I really dedicated my weekends because that's when I had the most available time. And I would say that the professors and the TAs are super accommodating. So at least in our cohort, they didn't necessarily tell us when the discussions were going to be. They asked us what would work best for us. So we every class was a little bit different, but um, it was all sort of consensus driven. So I found it really accommodating. We did a lot at lunch. We did some early evening, and I never felt like I was being asked to do something that was unreasonable. I mean, there's a huge amount of respect for the fact that the cohort, I would imagine, if not 100%, very, very close to 100% of people are working in demanding jobs. And I think that the administration and the professors are very aware of that.
Yeah, thank you. So Tom, I'll stay on you for this question as a recent alum now looking back at the degree. How do you find that the MHCI has impacted your work?
Yeah, I think it might sound funny because I was probably a little bit on the older side, but I didn't feel old. You know, it was nice to have a really broad mix of experience and age group. But I think it's been a while since I've been in higher education, and I think that the program really has helped me think with an open mind, more so than maybe I had been, think courageously, to ask a lot of questions. And I think it gave me, and maybe Kevin and others will appreciate this. It gave me a renewed appreciation for data and for making decisions that are empirically based, not decisions based on anecdotes or based on instinct. And the cool thing about healthcare is there's a lot of data. So we should use it before we make big decisions. And so I think, in summary, it's rehoned my thinking and analytical skills.
Yeah, thank you. Nadia, I know you're still in the degree, you haven't finished it yet, but have you noticed so far your studies having any impact on your work?
Definitely. So, just a little perspective. I'm a cardiothoracic based nurse. That's pretty much my whole experience, with some, shifts here or there occasionally. But throughout this time, I was able to really utilize what I've learned in the degree and put that towards, this COVID pandemic. And how I did that really was I was given kind of the opportunity to step up and open and manage two COVID departments. And so that included, new workflow processes, new COVID policies, managing over 40 staff members. And this is all kind of new, and utilizing kind of the knowledge that I learned in the first year, really assisted in my, straightforward thinking and like sturdy approach. And Tom is absolutely right. Data is like gold, but in a time where we have absolutely no data, um, I was able to really kind of hone in on what I've been learning and apply it to pretty much every single step that I went through during our COVID department's opening, coordinating with the Department of Health here, and then finding workflow processes and safety procedures that really worked. One, in the midst of a pandemic, and two, in my own personal situation at work. So I definitely see a huge impact and huge difference. I also felt like I'm on our policy council as well, and I felt that just the progression of me starting in the council was a little bit earlier than the program started, but I brought different things to the council every single month, reviewing new policies with new, fresh perspectives. Um, and I think that that's really what I came here to do. I came here for that impact, and for those little things that make big differences. And I appreciate that so far. So I'm excited for the future, honestly.
Yeah, thanks. That's kind of the point of the whole thing is seeing everything with fresh perspectives. Last question from me. I'll start with Tom. Can you tell us a little bit about the cohort experience? What kind of network have you built through the program?
Yeah, I would say that the networking's been good. I think for me as an administrator, as being on the administrative side, what I loved about the cohort was that there was a terrific balance between um, the providers, docs and nurses, as well as administrators. So it really helped. Even though I've been in healthcare, it's funny how we really live in different islands. Sort of the evil business people and the providers. But this class really immersed me in how the providers are really thinking through issues. So it's I'd say that's kind of part one. Part two is just the network of Penn in general, and how incredibly active the Penn environment is in terms of seminars, chats, information sessions. It's almost overwhelming how much is going on, and so the ability to plug into that network and that kind of knowledge base is really awesome. I kind of wanted to extend my time in the program just to keep all of my logons and access.
Yeah, it's great to hear. Nadia, what kind of network have you been building over the past couple of years?
So my initial, introduction to the program was in the in-person seminar. And to be honest, this was honestly one of the best experiences I've ever had in my education life. I was really shocked at the diversity of people. I might be, one of the, few international people there, but depending on the type of experience, the amount of experience, you can network, coordinate, collaborate, befriend pretty much anyone in the healthcare sector from any walk of life. You know, today I'm talking to a CEO, tomorrow I'm talking to a fellow nurse or a researcher. And to be honest, that in itself has been extremely valuable to my learning, my perspective, and also it's been an advantage to the Society of Healthcare Innovation, which was created by alumni and students, current students, and the new cohort as well. And it's just been great. I mean, I've constantly feel stimulated. I constantly feel like I'm working towards something that matters and something that makes a big impact, potentially globally, which is why I signed up in the first place.
Thank you. I just want to ask one question from the chat to you guys before I let you go. And I'm not sure of the answer. Had either of you considered another degree? Like, were you looking at other degrees when you were looking at the MHCI? And if so, what led you to choose the MHCI?
I did actually. I was looking at MHA, and as well as an executive degree in quality. What actually led me to MHCI was one, the interaction with the school, and kind of the accessibility, the availability of the department itself. Another thing that brought me to MHCI was I was able to review the curriculum for the MHA, and that one was, in my personal situation, too far-fetched and too technical. For me, it's more of like a C-suite executive degree. And so I felt that I had the ability to use this learning curve and take that where I wanted it to go. And I would find, to be honest, the most passion within this program. And it's worked out to be true.
Thanks. Yeah, that's a common question that we get is, what's the difference between this and, say, an MBA or MHA? And they're very different degrees. We've actually had a lot of students who have done MBAs and then also came on to do an MHCI because both degrees had different focuses and that person, got value from both. So some of the differences, again, I mentioned when I talked about the curriculum is that the MHCI, the unique focus of our curriculum is innovation and leadership together. An MBA definitely will be more broadly applied. It won't be as specific to healthcare. It'll be more management focused, so courses on things like finance, for example, that wouldn't be a part of an MHCI. So again, we've had students who found value in both, but there were different kinds of value depending on what you're looking for and what your goals are. And like Nadia was saying, an MHA might be more technical. Almost everyone in it will be in administration or going into administration, whereas in the MHCI, the student body is much more professionally diverse among all different levels of healthcare, so you're maybe exposed to a broader variety of healthcare roles.
Yeah, I would
So thank
say,
you.
oh, I'm sorry.
Yes.
I
Oh,
was
sorry,
just
go
going to
ahead,
say,
Tom.
I was just going to say that I do have my MBA, and I would say that for anyone who's comparing and contrasting, this program is really geared for people who are passionate about healthcare and really want to understand the healthcare environment, want to understand healthcare economics, and really want to understand how care is delivered and how to innovate on care delivery. Which with the MBA, for those of you who have one, it's it's definitely broader and it's all business. I mean, we don't spend a lot of time in business school talking about patient care. So it's definitely I think a very I'm really glad that I did it because it again, I'd say that this program is very, it's a very patient-centered program.
I agree. Thank you. Thank you, Tom and Nadia, so much for offering some of your, I'm sure, very precious time, especially Nadia for joining us at whatever ungodly hour it is for you right now. I know
My pleasure.
there are a lot of great questions coming in. In the interest of time, I want to make sure that we get through the rest of the presentation. But again, once we get to that Q&A at the end, we'll circle back and get to answer some of those questions. So let me get back to sharing my screen for the presentation. And we'll talk a bit about the course experience. So you just heard from Nadia and Tom a bit about what the student experience is like. And of course, an important part of that is the online course experience. The MHCI's online courses are designed to be flexible. They're designed specifically with full-time working professionals in mind. And so what that flexibility means is there are deadlines for assignments, but the content is available on demand, so you can access it and work on it when your schedule allows and when it makes sense for you to do so. All of the courses are on a platform called Canvas, which Adam will show you in a moment. Some of you may have used it before, but if you've never heard of it, that's totally okay. Again, students should expect to be spending around 13 to 15 hours per week while they're in a course, and that's total time on things that you might consider in-course time, like watching lecture videos, and out-of-course time, like working on different assignments. In courses, you'll find 3 different types of content. The first is media, so things like engaging lecture videos by the faculty members and interviews with special guests, readings that provide context and more resources to the lectures. You'll take part in different interactive activities like discussions in which you apply lecture content with other students, and again, those weekly interaction live sync classes with faculty. And finally, of course, assessments, things like quizzes, assignments, and projects that help you assess how well you're learning the material. So now I'm going to hand it off to Adam for a couple of minutes, who is going to show us what one of our courses on Canvas actually looks like.
Hi, everybody. Can you all see my screen, Catherine?
Almost, yes, I can see it.
Great. So what I'm sharing here is the inside of one of our courses. This course is a second-year course called Leading Change in Healthcare. And as you can see, it's actually the upcoming version that we're going to be running in the spring. And what I wanted to emphasize to you in this demonstration is 3 things. 1, that our courses are predictable. 2, that our courses are social. And 3, that they're supported. So I'm going to start with the third one, that our courses are supported. What you can see at the top of the screen right here is that we have contact information for the professors, we have contact information for TAs, and also for course support. So if you need help with content, with assignments, with due dates, or even with technical help, there's always somebody who's on the other side of the screen who can email you back and help you. We are a very human-centered program, even though we're online, and there's a lot of interaction that way. The second thing that I wanted to show you, just rolling down the page here, is the topics and key dates section. So topics and key dates is an outline on the front of every course that lets you know what's due at any particular time so that you can have it all at a glance. And what I really want you to notice here is that the work in this course is predictable. Everything is due on Sundays or Tuesdays for the most part. Everything that you need to turn in, at least. And you can see it all here, and it lets you put things in your calendar at the beginning of a course. It lets you plan your time, and I think ultimately it lets you plan your time across courses, because this isn't just true for Leading Change in Healthcare, it's true for all of our courses. So you have 6-week blocks where you're taking one course at a time. You get a week off, a week on, a week off, and at the end, it's all the same due dates. The last thing that I wanted to show you on the front page is down at the bottom here, the big red Start Here button. And when you click on that, it takes you to the modules page for the course. And now this is a detailed outline of the course. So what you see here for each week of the course is an overview. You see material you can watch. You see material you can read, and then you see activities, so interactions and practice activities and things like that. What I wanted to show you was one of those activities, just so that you can get a sense, and this is a discussion forum. This is the social piece of the course. Everything, almost everything, is an interaction. You are making posts based on the course content for your peers. Your peers are giving you feedback based on that course content and based on their professional experience. And then you're giving feedback to your peers. So at every step, there's an opportunity for the course content to reinforce the social aspect, to help you get to know your classmates. And also, there's an opportunity for getting to know your classmates, that social interaction, to help you reinforce your learning. So there's sort of a virtuous cycle going on in all of our assignments. The last thing that I will say about this is that students really do get to know their classmates through this process. There are informal ways that students interact. I know that a lot of our cohorts have other means of interacting with each other outside of class. They use Slack or WhatsApp or other unofficial means of communication. But they all say that getting to know each other professionally by talking to each other in the class is a really important aspect of building that cohort and building that network. So with that, I'm going to turn it back over to Catherine.
Thanks, Adam. There was one question that came in the chat that might be a good question for you about the courses, which is how
Sure.
can we integrate our current work experience into our courses? So for instance, can we integrate projects that we're working on into assignments?
Sure. I would say that many of our courses have projects that you can do at work. So, for example, leading change in healthcare, one of the things that you're asked to do in that course is to go out and do some fact-finding in your workplace. Find out what's going well, where are the challenges, where are the opportunities to improve processes and to innovate both on the work side and on the patient experience side. So there's those kinds of opportunities at every step, and I think that you see that even more so in the labs, where in those last two labs, pitching innovation and building a case for transformation, you really are working on projects that are for your workplace that you're going to be able to take with you when you leave.
Great. Thanks, Adam. So I'll share my presentation again. And the two things really I want you to take away about the courses is, again, they're flexible. They're designed for full-time working professionals. And like Adam said, they're really well supported. There's a team of humans here who are here to help you succeed. I will take one more question before we move on. Somebody had asked, how will the course change with Ezekiel Emanuel working on the new National COVID Task Force? And I thought somebody might ask about that. You might have heard Dr. Emanuel on Monday. It was announced will be a member of Biden's COVID-19 task force. And as of right now, there's no change. That appointment to the task force isn't necessarily an appointment to his administration. And unless we hear otherwise, he's at Penn. Teaching in the program as planned. Tuition, another question that we get very often. Students at Penn pay tuition based on the number of credits they've registered for in a given semester. So students typically pay at the beginning of the semester when they've registered for courses. Course credits at Penn are called course units or CUs. One CU is roughly equivalent to, a typical semester-long course, what other colleges might call a 3 or 4 credit course. So to give you an idea, each core course in the MHCI is equal to 1 CU. In the upcoming academic year, 2021 to 22, One CU is $5,794, and students take a total of 11 CUs throughout the degree, so that puts the total cost of the degree somewhere in the ballpark of $64,000. You can see in the table on the right the way that the CUs are broken down per semester on the 20-month track. Of course, on the 3-year track, it'll be a little more spread out. So depending on how you arrange your schedule, some of your semesters will have a fewer CUs in them. Students pay for the degree in a few different ways. Some students are self-funded. Many of our students are able to get tuition assistance from their employers. And some students choose to pursue financial aid. Just one quick note about federal financial aid, if you're considering that option, is that you need to be taking at least 2 CUs in a semester to be eligible for federal aid in that semester. So on the 20-month track, you'd be eligible for federal aid in every semester. On the 3-year track, since it's more spread out, you will have semesters in which you're taking fewer than 2 CUs, so you would not be eligible for that aid in every single semester. Just something to keep in mind in case you're considering it. I see a question. Is there specific intramural financial aid for Penn Medicine affiliated staff? Excuse me. There's not specific financial aid for Penn Medicine staff, but Penn University and Penn Medicine Health System employees do have tuition benefits that they can use towards the degree. Henry asks, does the GI Bill cover tuition? I know that veterans can use the GI Bill towards tuition. I don't believe it covers the full amount, but I'll be happy to talk to you about that individually outside the session, and we can find out what it would mean for you, and I can send you some more information about that. Okay, so we're almost done with the presentation. Before we wrap up and get to the Q&A, I do want to mention quickly that the department offers a couple of certificate options in case you decide that maybe a full-fledged master's degree isn't the right path for you. There is a graduate certificate in healthcare innovation. The graduate certificate courses are MHCI courses. They're exactly the same. You can take 4 courses in that certificate, and if you complete 4 of them in 2 years, you earn the certificate. The courses in the graduate certificate are transferable into the MHCI if you decide afterwards to apply and are accepted into the program. There's also a professional development certificate. These are non-credit courses, so they're not exactly the same as MHCI courses, but they cover a variety of healthcare innovation topics. Since they're non-credit, they can't be transferred into a degree program. And these courses, you can take them individually a la carte, or if you take 4 within a year, you can earn that certificate. So if you're interested in the certificates or have any questions about them, there's more information available on our website, improvinghealthcare.net, or you can feel free to contact me outside of the session and I'd be happy to answer your questions. And finally, how to apply to the degree. There are 2 application deadlines. The early application deadline is February 12th, and the final deadline for the year is May 1st. You can apply towards either deadline. Either way, you'd be starting the program in August 2021. The only real difference between applying to one deadline or the other is that if you apply before February 12th, you'll get your decision back sooner. They're not rolling admissions. The admissions committee starts reviewing applications after each deadline, and then decisions go out about 3 to 4 weeks after a deadline. To be eligible to apply, you need to have a bachelor's degree, and you need to have at least 3 years of professional experience in healthcare or, again, in a closely related field. To apply, you need to fill out the online application on our website, which again is improvinghealthcare.net. The online application will ask you to upload a personal statement, a current CV or resume, and contact information for 2 recommenders. And just something to be aware of, once you put your recommender's contact information into the application form, they'll automatically get an email from the system asking them to submit a recommendation. So just give your recommenders a heads up ahead of time before you put them in there so that they're ready for that email and they know what it is when they see it. Finally, the last required piece for the application is official transcripts from your previous schools. Transcripts are the only piece of the application that will come in separate from the online form. The transcripts need to be official and they need to come directly from your previous school. And we ask that you please send electronic versions to MEHP online, that email address which is in the chat and also on our website. If for some reason your previous school does not have an option for electronic transcripts, please just contact me and we'll work out an alternate arrangement for that. So that concludes our formal presentation. Once again, that first deadline is February 12th, and you can apply online at improvinghealthcare.net. So thanks again, everyone, for being here, and we'll take the next few minutes to answer your questions. So you can put your questions into the chat, or if you'd like to ask them aloud. And now's the time when you can unmute yourself and speak up.
Hey, Catherine, so somebody earlier on asked, are GRE or other exam scores required?
No standardized tests are required, and there's no application fee. I had seen it. Oh, go
If
ahead.
someone was interested in learning more about the program, would it be feasible to say have someone take 2 of those kind of graduate courses, certificates that you mentioned, apply, and then kind of apply those to the curriculum, once they're entered into the program?
Yeah, good question. You have the option if you wanted to kind of like test out the courses. You can apply to take a course, a single course. Or you can do the 4-course certificate. So it's 1 course or the 4-course certificate. If you just want to kind of see what a course is like before you apply, I would recommend maybe just trying out that 1 course to see what it's like. And you can always transfer that into the program if you're accepted into the degree later.
And how would you go about taking that 1 introductory course if that was something you were interested in?
There's an enrollment form on our website. So let me grab that and I'll put it in the chat in a minute.
Thank you.
No problem. I had seen a question earlier about how the curriculum has pivoted or will it pivot to accommodate everything that's happened with COVID-19 and how that's changed things. For sure, the assignments reflect that and talk about that. Adam, I don't know, you're a lot more closely involved with the curriculum than I am. Is there anything specific you'd want to point out?
Sure. What I'd say is that a lot of elements of the curriculum have pivoted. Like there are more opportunities to talk through the immediacies of our current situation, but we're also trying to stay focused on what's the big picture. So how can we use key skills that go beyond just the pandemic to help you address the pandemic, and then vice versa? How can we take lessons that we're learning right now from the pandemic and apply them once it's under control? Does that make sense?
Yeah, thank you.
Great, thank you.
I see a question from Doug. Clarification on transcripts. Are we talking about undergrad and grad school or just grad school? Many of our applicants have been out of school for a very, very long time. Typically, we ask for transcripts from any schools that you've gotten a degree from or done a significant amount of coursework at. So, for example, if you took 1 course at a local community college that's not really relevant to the MHCI, you don't have to get a transcript just for that, but any schools where you've gotten a degree from. We have someone in the chat who just completed 2 of the professional development courses. is it calendar year for the certificate? Again, this is the professional development certificate, or 365 days. It's 365 days. So when you started taking the classes, you have a year from that point. A question about whether this session is recorded from someone who wasn't able to log on at the beginning. Yes, the session's recorded. We'll send it out to everybody later this week. And if we apply to take a single graduate course, do we have to wait until the fall to take it, or can we take it when it's next offered? You can take a course before the fall. So the MHCI has courses in fall, spring, and summer every year. So you can take a course in spring or summer if you want to get that done, before applying to the program, before you would be starting as a student in the fall. A question from Lucy: if you took one or some of the courses as part of your undergraduate coursework at Penn, would those transfer to the degree? So Lucy, maybe you can provide a little more information for me. MHCI courses are not open to undergraduate students, so I'm not sure if you're talking about specifically an MHCI course, or maybe you took another course that was a similar topic to an MHCI course.
Yeah, so it was like Healthcare Management 850, so it was American Healthcare Systems with Zeke Emanuel. So I was just wondering if that was like the same as the course offered, or if there was a difference.
I think that is a different course, but again, that's something that we could look at on a case-by-case basis. If you send us the syllabus for that course, our assistant faculty director, Holly, could take a look and see how much overlap there is there with the American healthcare system.
Awesome. Thank you so much.
No problem.
A quick question. If things improve, is there no chance of an actual in-person meeting for the cohort within the first year of the program?
As of now, no. The plan is that there's not going to be an in-person meeting in the first year of the program. We really can't. We don't think there's a good chance of us being able to safely have an in-person seminar before this fall, when seminar needs to happen. And we had virtual seminar this past summer, which was a huge success. I mean, students really got a lot out of it. They made great connections. They were pros at using all of the online tools, and we heard from everyone that it was like the best online event they'd ever been to. So we're going to keep seminar virtual, and again, every cohort will get a chance to meet in person at that innovation weekend in their final year.
Hey, Catherine, if you don't mind, this is sort of in response to a previous question as well as this as this last one. There are ample opportunities for networking at the virtual seminar,
Yes.
including social activities, including a purpose-made chat environment, including some Canvas activities. So you do really get to know the other members of your cohort there.
Yeah, definitely. It looks like a couple people have asked about learning more from alumni of the program and about their backgrounds. If you contact me, I'm more than happy to put you directly in touch with a couple of alumni so you can ask them questions about their time in the program. All right, it's 5:01. How about I'll do one last question from Christine. Is there any involvement with the PCI Center at Penn? Informally so. We have faculty from the Penn Medicine Center for Healthcare Innovation and a lot of ties with programs through the PCI Center and the Penn Medicine Center for Healthcare Innovation, but there's no formal connection between us, but we're certainly happy to put students in touch with our connections there if there's an opportunity for that. All right, well, thank you everyone so much for being here. I know everyone's really busy and has a lot to do, so we're really glad that you can join us and learn a bit about the degree. Again, I'm more than happy to continue answering questions outside of the session. Feel free to email me, you can call me, and I'll talk through any questions that you have. We'll also send out a recording of this session in a few days. So thank you again, and have a great night.